Tonight, world health leaders are warning us this pandemic is far from over. In fact, some states starting to see Omicron cases decline, but they are rising in other states. Today, Indiana reported more than 16,000 new COVID cases. And take a look at this map. Every county is in red right now. That means the coronavirus is spreading quickly in all parts of our state. So tonight we want to start our big story with the help that hospitals are leaning on to handle the surge of people showing up sick.
Doctors here at IU say they are busier than they have ever been, so it's no surprise that they've asked a team of FEMA medical personnel to stay on an extra 30 days. The group of doctors, nurses, and respiratory therapists have been in the mix here at Methodist Hospital since late December. Turns out they are still needed as more hospital staff get sick from COVID or has to quarantine because of exposure to it. With the surge in COVID cases from the Omicron variant still not likely at its peak in Indiana,
we know we're still going to need all the help we can get for the next 30 days.
That means the medical team from FEMA is here to stay for the next month, continuing their work that started during the holidays.
Well, they help from the emergency room, our med units, and in our ICUs. So we are scheduling them just like we would our own team. And really, I think the value of that FEMA team has been to not only provide direct patient care, but it's also been able to provide some relief to team members working alongside them.
Even as the number of COVID patients across IU's health system went down briefly, Dr. Mark Lutenmeyer says they're on their way back up again with 634 COVID patients in hospitals across the IU system. 175 of those are at Methodist.
We have seen some increased discharges lately, but we are also seeing the total number of deaths rise. And so this has been the highest 30 days of deaths that we've seen since 2020's winter surge.
Of the patients IU is seeing in its hospitals on a single day, 70% are unvaccinated.
We are not seeing ICU patients with COVID that have been both vaccinated and boosted.
Dr. Lutenmeyer hopes the arrival of an at-home test kit from the federal government will make it more convenient for people to know if they're positive, particularly during a surge.
We know that at-home COVID tests aren't perfect. But they do give you more information than not testing at all.
And with flu season here and the number of those cases going up, doctors are watching closely, concerned about extra health care and hospital needs to deal with that too, on top of Omicron.
Those military teams are really important with hospitalizations still at record levels. As of midnight, there were almost 3,500 Hoosiers in the hospital. That's just shy of the record that we saw last Friday, marking the highest number of hospitalizations since the beginning of this pandemic. Right now, we're also seeing insanely high numbers of COVID cases across our state with this rapid spread of Omicron. More than 222,000 COVID cases so far just this month. That's a hard number to wrap our minds around. So think of it this way. That is one COVID case reported every 7 seconds over the last 18 days. One case every 7 seconds. And the actual number is probably higher than that because at-home tests are not reported, and some Hoosiers are struggling to find a testing appointment.
Right now, there are several nationwide efforts underway to slow down the rapid spread of the Omicron variant. It all boils down to tests, vaccines, and masks. The White House site, covidtest.org, is up and running now, sending 4 free at-home tests to households that sign up. 650 clinics across Indiana are offering PCR tests. The state confirming today they haven't received more rapid tests since last month because of the shortage and that their stock is depleted. But pharmacy clinics may still have some of those rapid tests available for you. Now, when it comes to the vaccine, most clinics have plenty of shots to go around. Just today, the CDC released new research showing just how crucial vaccines are to avoid catching COVID and then ending up in the hospital. Their study of 1 million people found vaccination combined with natural immunity offers the strongest protection against the virus. Masking up is the third piece of the prevention puzzle, and the federal government is sending out millions of those N95 masks next week. They'll be free, and you can pick them up from pharmacies and community health centers that are partnering with the federal government. If you need a mask in the meantime, make sure the one that you're buying is legit. The CDC right now estimates about 60% of the KN95 masks sold in the U.S. are really fakes. So tonight, to help you out, our Jenny Runovich shows you how you can spot the fakes.
KN95s are manufactured in China and not regulated by the U.S. The ones that do meet Chinese government standards should have a kind of serial code on the mask. If it doesn't meet safety standards.
You have to look on the side of the mask. It should say GB 2626-2019 or GB 2626-2006. Do you see that anywhere on the front on either side of the mask?
Not on this one. It's a fake. Also, make sure products don't have typos online or specifically claim legitimate in the listing. Usually means they aren't. N95 masks, experts say, are the gold standard, certified by the National Institute of Occupational Safety and Health. The real deal will have NIOSH printed on the mask, along with the model number and manufacturer. Also, legit N95s have head straps, not ear loops.
If you see a mask that doesn't have head straps that says N95 on it, don't buy it. Red flag.
Now with KN95 or N95 masks, you can't toss them in the wash like you did with your cloth mask. But our Verified team took a look at this viral paper bag trip to see if it actually sanitizes them. Experts say this works. We've got the instructions on how to do it correctly. You can find it on WTHR.com. And that wraps up tonight's big story.